Assalamualaikum semua. A very good afternoon. Today is 5th or 24th of May 2021. I think we entered 11 Shawwal. So I'm going to make and share with you basic surgical procedures. One is catheterization, and another one is suprapubic catheterization or Cystofix. Okay, it looks very simple, but it is not uncommon that you receive a referral from other department that they refer to us with problem with catheterization, unable to change the CBD stuck, patient develop hematuria after the catheterization. So I'm going to share with you the right technique and when, how, all the prerequisites before you insert the suprapubic catheter. Okay, in surgical department, catheterization is a must. Not only surgery, for other discipline, medical, pediatric, ONG, orthopedic, catheter is not a special procedures. So you must know how to insert. Okay, so as a basic thing, indication to insert the CBD is basically for either monitoring the urine output for critically ill patient, for example, or sometimes it's therapeutic or preventive, prophylactic, for example in acute urinary retention, or to reduce the obstructive uropathy in BPH. So you need to insert the CBD. So what are the size of CBD? You can have various size in adults, 16 French, 18, 20, 22, the biggest is 24. You can have normal catheter, or you can have this triple lumen where you can irrigate. You can irrigate. Okay, in pediatric, they can have small size 12, 10, 8 with stellate, and if in infant or child, in baby, we can use feeding tube to catheterize the urine. Okay, let's see the catheter. So you have to clean the parts. Nowadays we try to use chlorhexidines. If you have to use providone iodine, make sure you clean it with saline after you use, otherwise it can cause burn. Alright, so you have to lubricate the area that you want to insert, the external urethral meatus. So where is the area of cleansing? Means for catheterization, if by right, if you put the patient under in OT, for example, you are assisting the operation where you need to empty the bladder, you need to clean the area below the umbilicus until the mid thigh, and also the area of genitalia up to the glans penis. You have to clean everywhere. So these are the area, and you have to put the cyst towels and then hold the penis with the left hand in 90 degree, erect position in 90 degree. Okay, so first of all, before you insert, you have to test. You have to test the balloon here by inflating water for injection. Water for injection into these lumens, and it's written there how much you can insert. Some say 10 cc, like bigger catheter 24 for example, can inflate it until 30 cc. Alright, so after then you have to lubricate the external urethral meatus using vacuum lidocaine, or you just can use lidocaine gel. Okay, you can just use lidocaine gel and lubricate it. If patient is aware, patient is alert, you give sometimes like 5 minutes for example, and then insert. Okay, so when you insert through external urethral meatus, when you have to hold it upright like this, 90 degree. Okay, you have to hold it upright. Jadi just you have to hold it right 90 degrees, and you have to insert it. Okay, when you insert it, there shouldn't be any resistance. It should go all the way. It should go all the way. It should go all the way. Okay, let's say you insert until this end, and then you realize the urine comes out. Don't inflate the water for injection at this stage. You need to push it all the way until the bifurcation. If you inflate the balloon at this end, at this stage, the what do you call that? The tip of the catheter is still in the penile urethra. It's not in the bladder. So as a result, it can cause distension injury to the penile urethra, right? So you have to push it all the way so that the tip will bypass the prostate, will go through the prostate and then inside the bladder, so you can safely inflate the water for injection. After you insert the water for injection, according to the volumes like 10, 15 or 20 cc written here, you push and you pull the catheter until it's snap. Okay, until it's snap. Alright, until it's snap. So connect the tip to the back. Alright, that is the procedure. Why we use the water for injection? This is very important because you can see color of the water for injection, color of sodium chloride solutions are the same. If you use sodium chloride crystal, after some times they can become crystallized, and this solution can become crystallized. As a result, when you want to remove the catheter or change the catheter, you are unable to deflate the balloon because of it is become sodium chloride crystals. So that's why we use water for injections. Alright, sometimes complication do occur because of this because of some of you using sodium chloride crystal, so they cannot deflate the balloon. So you know the problem is the crystal will occupy the small lumen here and then causing obstructions. So sometimes you can see people cut the catheter just to release the obstruction. That is wrong. Okay, that is wrong. So when you encounter the problem, how are you going to solve it? Okay, one way, the safest way is push back all the catheter until the end and then use water for injection or saline. Try to inflate the balloon as much as possible with the intention of rupturing the balloon, but the main precaution here is the tip of the catheter must be inside the bladder. So you push until the balloon ruptured. If that maneuver fail, what is the next step? The next step is, this is after you consult your medical officer or specialist. The next step is you can some people they cut this thing, but the danger part if you cut this end is the catheter can just accidentally slide in and then left in the bladder. Then you need to do some surgical procedure to remove it. So please don't cut this. Okay, if you fail, you can get the help of the radiologist, get them perform an ultrasound, see whether the balloon is still distended or not, filled with fluid or not, and then with under ultrasound guidance, you can help to aspirate the water, the balloon filled with water for injection. Under ultrasound guidance, we use needle to aspirate. The local use needle to aspirate. That is 2 ways. There's another way where I'm not going to share with you. Later you become medical officer, you will learn something. Alright. Okay, there is an occasion where you cannot insert CBD. Right, you cannot insert CBD. You try to insert, fail. You try to insert, resistant. You try to insert, causing trauma. So these are the time where patient is in severe pain. So there is indication for you to insert suprapubic catheter or Cystofix. Prerequisite before you insert the Cystofix or suprapubic catheter, you must make sure patient is not end-stage renal failure or acute renal failure patient where there is no urine. So you must examine the patient, percuss the abdomen, palpate, and there must be dullness above the pubic symphysis. There is some form of mass. That is urinary bladder. So where is the surface landmark? Surface anatomical landmark is pubic symphysis 2 cm above or 2 finger breadth above. So you give local. Okay, give local lidocaine. You give local to the skin and then to subcutaneous tissue. And once you complete giving local, you can even advance the needle to the urinary bladder and try to aspirate the urine. So you can, if you can aspirate the urine, okay, you can aspirate the urine. Okay, let's say this is surface abdomen, this is pubic symphysis. This aspirate the urine. Okay, so you can just leave this syringe upright like that. Okay, then take out the SPC. Okay, suprapubic catheterization. There are many products nowadays. You can have normal suprapubic catheter size 12 where you have sheath outside and trocar from inside, or you can have this plastic Cystofix size 16. Okay, size 16 where the mode of introduction are almost the same. Okay, just now I mentioned. Okay, this SPC consists of the thick end and the outside trocar where you have sheath here, and this is the trocar, this is the thick end. Okay, so this trocar actually will be inside the skin so that you can pass the catheter later on. Right? Okay. So after you give local, just now I mentioned that you give local and you can see urine out, just make a small incision next to the next to the needle. Is the surface landmark still 2 cm, 1 cm above the pubic symphysis, and then make a small incision with blade size 11, and then you puncture this Cystofix upright 90 degrees. Okay, with control. Okay, you push all the way until you can see urine suddenly jet out from this opening. Okay, you push some more and then you withdraw. Okay, you withdraw this. Okay, you withdraw, but you must make sure you push until urine comes out. Once urine comes out, you withdraw this trocar. Once you withdraw this trocar, pass the catheter all the way. Okay, size 16 and below. Okay, all the way, size 16 and below. Even this is size 18. So you pass it all the way, and then once the urine comes out through this tube, then only you withdraw the sheath, and then you can break it. This plastic end is very elastic, you can break it. And okay, how far you insert the catheter? you can insert the catheter and inflate the balloon. Okay, inflate the balloon. Again, once you inflate with the amount given, pull the catheter out. Once you feel the resistance, close the skin and anchor it at the skin. Alright, anchor it at the skin. Okay, this is the one is widely used in urology department or general surgery ward. The traditional suprapubic catheter basically comes with the suprapubic catheter, which is hard plastic catheter size 12. Alright, size 12 or size 16. So the technique is still the same. When you see the urine out, you take out this thing, introduce that suprapubic catheter, which is smaller than this, and there are markers. In that situation, the catheter has no balloon. So how far you want to insert depends on the two dotted black line. Okay, two dotted black line. So you push until you see the urine, and then you take out this thing, and then you can see two dotted black line, and then you push it until you in the first place you push it all the way until you see the urine. You push it all the way, then once you release the sheath, you pull out until you see two dotted line black. That is the place where you need to anchor. Okay, this is the catheterization and suprapubic catheterization. Maybe a little bit fast, but at least you get an idea okay, about the CBD incision and suprapubic catheterization. Thank you very much. See you next time.